Hello, I am Jan Michael Santos, your instructor for seminar, and this is our seminar lecture series wherein I'm going to talk about things that are related under health and medical technology. So for this week, our topic would be about breast cancer. So I'm sure in the Philippines this is quite a common cancer, and I'm sure some of you knows a person or a relative that had breast cancer and probably died from it. Okay, so here are some facts about breast cancer. According to WHO and the International Agency for Research on Cancer, it is known to be the leading killer of women ages 35 to 54. And actually 1 million develop the disease without knowing it. That's why later on along our lecture discussion, I'm going to show you, especially the girls, on how to do self breast exams, because this can be beneficial at your young age, especially that yun nga, in the Philippines it is relatively high, especially if you have a family relative that had breast cancer. So in the Philippines, it has the highest incidence rate in Asia. And in fact, in the Philippines, it is the ninth highest in the world. Diba? So pasok pa tayo sa top 10 that has the highest mortality rate on breast cancer. So in breast cancer, so this is from the Philippine Cancer Society, the breast cancer incidence, mortality, and survival, it states there that breast cancer is the leading site for both sexes combined. So both male and female, so at 19% in 2015, and ranks first among women, which is at around 33%. So an estimated 20,267 new cases is estimated to occur among women, and that's quite alarming, no? 20,000. So, and the incidence rate starts rising steeply at age 30, and the incidence rate has been steadily rising since 1980 with an average of annual percentage change of 1.2%. So, this might be a product na din of the screening that we do. Wherein mammography is now readily available in some institutions. So here are the facts on cancer, especially on the percentage. So as you can see here on this table, breast cancer seems to be, or seems to have, the highest percentage among cancers, followed by your lung. And of course, when we are talking about gender-wise, of course, for male, it's going to be prostate, but if it is female, it's going to be the breast. Lung here is also as quite high, which is, of course, sometimes the lungs is one of the most common sites for metastasis, kasi so that's why it's also up there. But all in all, breast cancer has the highest percentage among all the cancers that up to date. So this is research done in 2015 but still holds true up to this 2022. So this one, because of the rising incidence of breast cancer in the Philippines, the Philippine College of Surgeons actually created this pamphlet, wherein they included here the things that you need to know about breast cancer. And this pamphlet is very informative. So nandito na lahat, nandito na yung self-breast exam. They concised it in a sense that you, Filipino lay women, yung mga hindi man adapt sa healthcare or sa health language, they can easily understand. So here are the facts and figures, warning signs, early detections, the possible treatments, because breast cancer can be treated. And also here is the self-breast exam. So those are the facts, and now let's talk about the risk factors for your breast cancer. Breast cancer per se will develop if you have this risk factor. So it can either be hormonal or non-hormonal. So when we say hormonal, this is attributed to your estrogen exposure, and as a rule in breast cancer development, if there is increased exposure of women to estrogen, there is an increased risk for developing this cancer. So what are the instances wherein you have an increased exposure for estrogen? Of course, once you start your menstrual cycle, that's the time also wherein you are producing a lot of estrogen. So, kapag rineregla ka na, that's the time din na nagpo-produce ka na ng estrogen. So, the earlier that you are exposed, or the earlier that you develop menstrual cycle, or the earlier that you had your menstrual cycle, the earlier that you also has been exposed to estrogen. Going further down the line, the later that you have your menopause, you also have an increased risk or a longer exposure for estrogen. So both ends, both extremes, early menarche and then late menopause, that increases your risk for developing menstrual cycle, mainly because you are exposed to estrogen more. So moderate levels of exercise and longer lactation period, this naman is decreased risk, or these are protective. Bakit? Because as you exercise, you are consuming your estrogen. So, ginagamit mo yung estrogen mo to burn off your fats. So, doing things that are physical, so do exercise, aerobic exercise, or whatever, basta gumagalaw ka, you are burning your fats, which are storage for your, or reservoir of your estrogen, yung mga fat cells ninyo. And then older age of first birth, also increased risk. So the longer that you bear your first child, so you are, kasi diba in pregnancy, nasusuppress yung production ng estrogen niya. So if late ka nang nag-start or nagbuntis, so higher yung chances mo, or higher yung chances mo na magka-breast cancer because longer ulit yung exposure mo to estrogen. Also in here is your obesity. As I've said, that's why it's important for you to involve yourselves in physical activity. Because when you start gaining weight after, because you as women, you will start gaining weight after menopause. And the source of estrogen in postmenopausal women is the conversion of your androstenedione to estrone by your adipose tissue. So the more adipose tissue that you have, the more estrone or estrogen that you will produce. So, and then as I've said, the more estrogen, longer exposure to estrogen, higher risk for breast cancer. And then we also have here your non-hormonal risk factors. So these non-hormonal risk factors can be modifiable because these are your lifestyle-related breast cancer risk factors. Breast cancer risk factors you cannot change. Factors with unclear effects on breast cancer, and then these proven or controversial breast cancer risk factors. So let's go to them one by one. No? But in as a rule in non-hormonal, as I've said, this can be modifiable. So, for example, radiation exposure. So, as much as possible, if you can limit your exposure to radiation, like kung hindi naman necessary yung pag-x-ray mo as a girl, opt not to do x-rays. Or what else? Alcohol consumption, because alcohol consumption is known to increase serum levels of your estradiol. Diba? Alcohol, diestradiol. So that estradiol will also be converted to your estrogen. That's why kung alcoholic ka as a girl, mas mataas din yung estrogen mo. And then ano pa, yung mga consumption of high fatty foods, because those are all going to be converted to your fats, which is going to be a reservoir of your estrogen. Okay, so let's go first to your lifestyle-related breast cancer risk factors. So included here are your drinking alcohol, no? So what we do in medicine, as they taught us, no, when we try now to interview a patient, especially if we suspect cancer, we try now to ask if they have risk factors, because risk factors per se are the reasons or that we might suspect that this person or this patient really has cancer. Like for example, tatanungin namin ngayon kung kung umiinom siya ng alcohol, ganon, or may family history sila, ganon. So drinking alcohol, as I've said kanina, because drinking alcohol will increase your estradiol production. Being overweight or obese after menopause, not being physically active because of your adipose tissues, not having children or first child after the age of 30, diba, the best, that's why they defined the early 20s to late 20s as your reproductive age, diba? Because that's the perfect time we're in to bear a child. And then not breastfeeding. That is why we also promote breastfeeding, because when a mother breastfeeds her child, there seems to be a suppression of estrogen. And then your birth control with hormones. So kapag nag-pills ka, like, because your pills also contains your oral contraceptive pills also contains estrogen. So that's why if you are taking pills, Depo Provera, implants, patches, mga ganon, you are also increasing your risk for getting breast cancer. Hormone therapy after menopause, and as well as your breast implants. And then here are your breast cancer factors that you cannot change. So yung una natin, we can still change them because these are lifestyle related. And then this one, you cannot change them. So inherent na sa inyo to kung meron man kayo. So of course, number one dyan, being a woman. Of course, women tend to have higher chance for getting breast cancer because they have more breast mass than males. But that doesn't mean that you as a male will not get breast cancer, okay? But being a woman really increases your chances for getting breast cancer 1,000-folds than men. Okay, and then getting older, certain inherited genes, if you have the BRCA1 and BRCA2, your BRCA or your breast cancer 1 gene, and then breast cancer 2 genes. Having your family history of breast cancer, so whether they are in your maternal side or in your paternal side, you are predisposed to have breast cancer later on. Also included here is having a personal history of breast cancer. Kung meron kang breast cancer noon, that's why in some women, when they develop breast cancer, some opt to do bilateral mastectomy already. So kung tatanggalin nila yung isang breast nila, they also remove the other breast so that recurrence is lowered. Having dense breast tissue, so kung mas malaki yung breast mo, you are more prone to having breast cancer. And then we also have here your race and ethnicity, certain benign. That's why you as a Filipino, napakataas ng risk natin for having breast cancer. Certain benign breast conditions like your lobular carcinoma in situ and your ductal carcinoma in situ, starting menstruation early or before age 12 years old, going through menopause after age 55. That's why taka na kayo kung, or kabahan na kayo kung later on 50 na kayo, hindi pa kayo nagme-mens, ganun. So ganun din kasi yung every time kasi na napapag-usapan tong breast cancer, I cannot eliminate the thought of one of my lola that died because of this, because she was single. So ayun, yung isang risk factor niya yun, never siyang nag-bear ng child, and then napaka-aga daw niyang nag-mens. So at age 9, nagme-mens na daw siya noon, and then she had her menopause at age 58. So that's why lahat ng mga nandito ngayon na facts, these are really proven by researchers, because and I can attest because I know someone that really had these risk factors. And then going through menopause after age 55, and then having radiation to your chest. So factors with unclear effects on your breast cancer. So we have here your diet and your vitamins. So these are yet to be proven on their effects. Okay, but some researches are ongoing. Although the diet and vitamins, diet really can affect. If you are consuming high fat foods, of course you are predisposed to being obese. For the consumption of vitamins, there is no clear link yet to breast cancer if it can increase or decrease the risk. Chemicals in the environment, of course, if you are exposed to benzenes or other toxic chemicals, especially in the lab. You can also have here your tobacco smoking or your smoking. Of course, given na yan, every time na we suspect someone of having breast cancer, tinatanong talaga namin kung smoker ba yan or hindi, because smoking will really increase your risk to any type of cancer. Night shift work. In night shift work, no, some studies have suggested that women who work at night, so basically kayo din as students, no. But in the research that they did, they got night shift workers na mga female, such as mga nurses and yung mga taga call centers. So they found out, or they hypothesized, that they might have an increased risk for breast cancer because of looking at the results of that research. They think that the effect may be due to the changes in the levels of your melatonin. And of course, you know that melatonin is the hormone that is affected by your body's exposure to light. But the effect of melatonin, or the link of melatonin to breast cancer, is still being studied. But the link is very tightly probable daw. But yun. So as much as possible, even though it's not yet proven, I just hope that you get a good night's sleep and wag kayo masyadong magpuyat as girls. Kang mga girls. Okay? So ito naman, these are some proven or controversial breast cancer risk factors, like because I've heard before that using antiperspirants daw, kasi nga kapag nag-apply ka ng antiperspirant, it might go to your breast daw. But that doesn't say anything on the development of breast cancer. So antiperspirants, bras, or your induced abortion, it will also not affect your you to develop breast cancer. Especially the bras, no, yung mga gumagamit daw yung mga masisikip or whatsoever, it's more of a comfort and not about the development of breast cancer. Okay? So of course, if you have risk factors, it's good to know that, or to identify the risk factors. Now we go to risk management, so that those risk factors will not completely go, or will not really make you develop the disease. So included here in your risk management is the notion that when to use postmenopausal hormone replacement therapy, the age to perform mammography or screening or MRI, when to use tamoxifen to prevent breast cancers, because there are drugs that we can actually use, like your tamoxifen and your mastectomy. So the question now is, can breast cancer really be prevented? So we cannot actually prevent your breast cancer, no, once you have the risk factors, especially the genes, your BRCA1. If you have familial history, there is that possibility talaga na magkakaroon ka ng breast cancer. But then we can at least lower the risk. How? Of course, if you know that you are obese and you are at risk for breast cancer, you need to intervene. So you need to stay or to have a healthy weight. Okay, so be physically active, limit or avoid alcohol, and if you are pregnant, opt to do breastfeeding. Of course, a lot of things or a lot of beneficial things are being brought to us by breastfeeding. That's why in the medical field, we are really advertise or advocate for breastfeeding and not bottle feeding, like the introduction of your normal flora, or the priming of the gut of the baby, the colostrum, wherein your IgAs and a lot of proteins and minerals that are needed for the baby to develop is really in the breast milk. So we can also have here your hormone replacement therapy after menopause, because after menopause, you as a female will have hormonal imbalances. So, but take note that not all hormone replacement therapy will be beneficial, because as I've said, estrogen is also a hormone. So we must really, you as a female, you must really talk to your physicians, especially those who are adept at cancer, like your mga oncologist or your family physicians, if you are if you are going to or to consider hormone replacement therapy for your signs and symptoms of your that you will develop after menopause. So the first step in deciding if you should take a drug to help lower your chances of getting breast cancer is to have a healthcare provider assess your breast cancer risk. Because if you have, if makikita talaga nila, based na rin sa Gail Model natin later on, if makikita nila na napakataas nung breast cancer risk mo to develop breast cancer, of course, they will now give you medications para ma-lower na natin yung risk. But if you have relatively low, maybe we can still do lifestyle modifications, mga ganun. And then here, this is your breast cancer risk assessment tool. So this is also known as your Gail model, and it is commonly used to assess your risk for developing breast cancer, and it can estimate your risk of getting breast cancer in the next 5 years or over your lifetime based on many of the factors. So the factors are listed in here. So kung nakuha ninyo, no, this one I gave it to you as an activity. So if you are a female and your menarche was, for example, 10 years old, so that will give you now a relative risk of 1.21 already. And then if you had biopsy specimens of benign breast disease, if nagkaroon ka ng something pathologic or naka-feel ka ng anything in your breast and then you opt to have it biopsied, so kung wala pa, automatically meron ka ng 1, 'di ba? So as you can see here, kahit na wala kang history of histopath, no, you still have the risk. And then age at first birth, so ganyan. So kapag may mga relatives din kayo, so what I want you to take away from this Gail model is that whatever the circumstances are, even your menarche and then your number of biopsies only are to be considered, you will have a risk, okay? And for example, dito meron kang 2.21% of developing breast cancer. 2.21% is not zero, okay? So that 2.21% tells a lot, okay? That 2.21% of your life in the next 5 years, you will develop breast cancer, diba? So God forbids, no, but you have this number that can really predict, or you have this percentage that estimates your risk of having breast cancer in the next 5 years. Okay, so it's important later on that you do self breast exams and mammography. Okay, so also included here in our discussion would be the breast cancer gene mutations, or your BRCA. Okay, so your BRCA gene is autosomal dominant in nature, so hereditary risk. So you should obtain a complete multi-generational family. It could be from their fathers, di ba? So kung tanungin nyo lahat ng, kung may tita kayo or tito kayo or mga grandmother kayo na may breast cancer, you ask kung meron pa ba noon, i-trace nyo sa generation nyo hanggat sa makakaya ninyo. Okay, and then assess the appropriateness of genetic testing for a patient, and then counseling the patient. That's what we do after genetic testing, no? Whatever we find out in your genetic testing, of course you need to be counseled. And then it's also a need to interpret the results afterwards. So in here, this is the incidence of your breast cancer. As you can see here, sporadic breast cancer still holds. When we say sporadic, it just occurs even without familial predisposition. Even though if you don't have any family relative that had breast cancer before, sporadic breast cancer means that you just develop breast cancer sporadically, spontaneously. So sporadic breast cancer has 65 to 75% incidence out of all the incidence of your breast cancer, and then to be followed by your familial breast cancer and then your hereditary breast cancers, in which if you inherit your BRCA1 and then BRCA2, napakataas at 45%. So of course we also have other genes, you have here your P53, which will predispose you to Li-Fraumeni syndrome, in which if you have the Li-Fraumeni syndrome, you will have breast cancer later on. Or your P10 gene mutation, your Cowden's disease, and then your ATM gene or your ataxia-telangiectasias. So that also will predispose you to having breast cancer later on if you develop this type of diseases: Li-Fraumeni, Peutz-Jeghers, Cowden, Mori-Torres syndrome, ataxia-telangiectasia. Okay, so in here, cancer prevention for BRCA mutation carriers. So what can we do, or how can we intervene if you now have the BRCA gene? Okay, so we must do risk reduction mastectomy and reconstruction. Okay, so kapag na-screen kayo in your genetic testing that you have the BRCA gene, you might opt to do mastectomy already para hindi na siya mag-develop. And then reducing salpingo-oophorectomy. So tatanggalin na yung fallopian tube mo and your ovary, because syempre, di ba, your ovary will produce your estrogen. So basically, if you remove the estrogen now, that would really reduce your risk to develop breast cancer. Intensive surveillance for breast and ovarian cancer, because these two goes hand in hand. Kung may ovarian cancer ka, you will develop breast cancer with the high probability. We can also opt to do chemo prevention. And then in mastectomy, it does not remove all breast tissue, and women continue to be at risk because germline mutation is present in any remaining breast. That's why later on, makikita nyo yung mga other types of mastectomy. You can have radical mastectomy, either complete or partial. Okay, most of the considerations for mastectomy really is on how we will reconstruct the breast later on. But of course, prevention is better than cure, so hindi na baleng pangit basta or wala ka ng boobs, at least mabubuhay ka, diba? So in reducing the risk of your surgery, so you can have your prophylactic mastectomy, so it can reduce your risk by 90%. So kung ipapatanggal mo na yung boobs mo or your breast, it can reduce your risk by 90%. And as I've said, mastectomy will not actually remove all the breast tissue, and that remaining 10% might still predispose you to having breast cancer, but at least na-lessen na siya by 90%. And then the carriers of your BRCA mutation, high-risk women, so these are all candidates for your surgery. The carriers are of your BRCA mutation, high-risk women, and there is little data to support your prophylactic oophorectomy. Diba, as I've said kanina, your breast and your ovarian cancer will go hand in hand sometimes, but your prophylactic oophorectomy, it has little data to support that if you remove your ovaries, you will also reduce the risk for breast cancer. Better pa rin ang prophylactic mastectomy because you are targeting the breast itself and not other organ. So we can also have here the use of your Tamoxifen, these drugs, for example, your Tamoxifen, this is a drug that selectively or modulates your estrogen receptors. So kung i-modulate niya yon, for example, yung mga breast cancer kasi that are estrogen receptive positive, or your ER positive mga breast cancer types. So kung i-block natin or i-modulate natin yung pagdapo or pag-combine ni estrogen doon sa mga receptors niya doon sa breast, we will lower the risk, diba? As I've said, the exposure to estrogen is a great risk factor. So kung si Tamoxifen, it will block the binding of the estrogen to its receptor. Of course, there will be no exposure to estrogen. We can also have here your Raloxifene. So again, its effect is also the same as your Tamoxifen and your aromatase inhibitors. So your aromatase inhibitors, of course, you know that your aromatase is a review in your clinical chemistry. Ano yung enzyme? This enzyme your aromatase will convert your dihydro androstenedione to your estrogen, no? If my memory serves me right. Basta si aromatase is the enzyme responsible for making your estrogen. So if you block your aromatase, or if you inhibit your aromatase, it will now we will now have a decreased production of your estrogen. So as you can see here, yung mga drugs na to, it really targets your estrogen. So let's go to your breast cancer screening. And most of the things that are in here are adapted from our book in medicine called Schwartz. It's a book regarding surgery, because breast cancer is taught to us in surgery in med school. So breast cancer screening, you can have here your mammography. So when we say mammography, later on I will show a machine that does mammography. Okay, so it is recommended to undergo mammography if you are 50 years old. And then if you are less than 50 years of age, it's still controversial, and it is more applicable if you have greater breast density. And then some factors, no, if you are less than 50, you might produce false positive results. And then it is believed that younger women are less likely to have breast cancer. That's why if you are less than 50 years old, you might not opt to do mammography. But if you know someone like your mom or your grandmother that are above 50 years old, you might tell them to at least go to a healthcare provider and then have them undergo this procedure. However, if you are a woman, even though if you are less than 50 years old, but then you have high risk, for example, meron kang family history, and then malaki yung breast nyo because you have high breast density, so you might opt to do mammography. And then the American Cancer Society, in 2015, they stated that annual screening for breast cancer can be done by the age of 40 to 44, and then annual mammography might be done greater than 45, and then biennial mammography greater than 55 years old, and then clinical exam is not recommended for average risk. When we say annual screening, and you're in annual screening is or when we say clinical exam, that is done by your physician. When you say self-exam, that is done by you. So later on, you will see the difference. So this is another infographic, by the American Cancer Society recommendations for early detection of breast cancer. And this is the guideline for women at average risk for breast cancer. So if you are 40 to 44, you have the option to start screening with mammogram every year. If you are 45 to 54, you should get the mammogram every year. So hindi na siya choice, it's command na siya. And then if you are 55 and older, you can switch to mammogram every other year, or you can choose to continue yearly mammograms. And then screenings should continue as long as a woman is in good health and is expected to live at least 10 years more. So here, you have here your breast cancer screenings. So you have here your mammogram. Yung mammogram nyo, the breast will be iipitin siya. That's why sometimes the main reason why women, even though this is a relatively beneficial procedure, the reason why women opt not to do it because of the pain. Masakit siya kasi naiipit yung breast. Yan, ito yung mammography na sinasabi natin. Meron kang x-ray beam, and then the film plate, and then camera unit, and then pipicturan. Para din siyang cancer, pero yun nga lang, iipitin yung breast mo. Sir, di ba sinabi mo kanina, avoid radiation exposure because radiation exposure will predispose or give you higher risk factors. The X-ray beam that we are using in your mammography is actually lower than it is substantially lower than the X-ray that is being produced by your conventional X-rays for the chest. Okay, of course, alam na yan ng mga scientists, ng mga doctors. That's why na-adjust nila yung dosage of the X-ray. Okay, so these are just new recommendations, no, on your breast cancer screening. But the takeaway here is the best screening for your breast cancer is not clinical exam, it is not your self breast exam, it is by your mammography. Okay, so if it is nice to do self breast exams. Later on I will show you, or I will teach you how, but still the screening, the best screening method for your breast cancer is still your mammograms at age 45. Sir, bakit ba hindi na ginagawa yung self breast exams, or hindi recommended yung self breast exams? Well, no, if you do self breast exams, that will not actually lessen the mortality rate of your or your chances, or it will not actually lessen your chances of being alive. Okay, because self breast exams are very subjective in nature, as compared here in your mammograms, which are very objective. So just opt to do mammograms rather than self breast exams or clinical breast exams. This is more accurate. Okay, so ayan. So breast cancer is generally painless, and then that's why if the most common presenting signs would be just a breast mass. Okay, breast mass lang talaga yung nakakapanyo. That is not painful. And then if you will now have or develop the signs and symptoms generally manifesting now all over your body, it is too late kasi most probably nagmetastasize na siya. Okay, so early detection, if you detect breast cancer by age 20, monthly self-breast exams done at 10 to 14 days after menstruation. Why? Because if you do it within or after your menstruation, matigas yang breast ninyo, di ba? And then by the age, so do self-breast exams 10 to 14 days after menstruation, because dun pa lang mag-start na babalik yung original consistency ng breast ninyo. And then by age 30, annual clinical breast exam. So pupunta ka na ngayon sa doktor mo para siya naman yung gumawa ng breast examination. And then by age 50, mammography. Okay, so all suspicious masses or abnormal changes should be biopsied immediately. As I've said kanina, the most common presenting sign would be breast mass. But kung may nakita kayong changes that happen to your breast, that is an alarm, or that should trigger an alarm in your mind na there is something wrong in your breast. So go to your physician immediately for you to be screened. So you have here your natural history. If you have breast cancer and then you did not receive any treatment, so your median survival time would only be 2 to 7 years. So by the time that you are diagnosed and then you did not receive treatment, so you have 2.7 years of survival rate. And then if you had a 5-year survival rate, a 5-year survival rate was seen in 18% of the cases, and then 10-year survival rate was seen in 3.6% of cases of untreated breast cancer. And then sobrang rare na yung mabubuhay pa ng greater than 15%, at around 0.8% na lang siya. So we are talking about breast cancer, no? And in here, in order for you to understand a bit on why breast cancer occurs, is that we have here your breast cancer pathogenesis. So let's take a look. Bakit nga ba nagkakaroon ng abnormal cell growth? So in your primary breast cancer, no, you have the cells invade the surrounding tissue. So as you can see here, no, in your this one, the anatomy of your breast. So the yellow portion is your adipose tissues, okay? And then this one is your milk glands or your lobules, okay? And then yung branch na ito, this one, this is your ducts, okay? DUCTS, ducts. Then this is your lobules, ducts. Okay. So there. And then basically this is your basic anatomy of your breast. Okay. So in your breast cancer pathogenesis, the cells in cancer cells, if they will start invading the surrounding tissue, may it be the ducts or the lobules. Desmoplastic response entraps and shortens the Cooper's ligament. I think hindi ko siya napakita dito yung Cooper's ligament. Sometimes kasi may Cooper's ligament dito that anchors your let's use another color. Ayan, may Cooper's ligament ka dito para ma-maintain yung shape ng breast mo. Okay, so basically later on yung Cooper's ligament mo kapag na-entrap yan, magkakaroon ka ngayon ng inverted nipple or sometimes dimpling ng skin or magkakaroon ng slight deformity yung breast mo because kapag na-entrap itong mga Cooper's ligament mo, of course, mawawala yung structural integrity ng breast mo. Hindi na maganda yung form niya. Okay? Okay, and then if na-shorten yung Cooper's ligament mo, there would be skin retractions. That's why I've told you kanina there would be inverted nipples and sometimes there would be pseudo-orange manifestations, yung pagdidimpling ng any part of your breast. Sometimes, kung nasan yung dimpling part, nandun din yung breast mass. So, after that, there will be disrupted drainage of lymph fluid from the skin. So kapag na-disrupt yung lymphatic drainage natin, there would be localized edema. That's why nagkakaroon ka ng pseudo-orange na phenomenon. And then the cancer invades the skin and then you will now have your ulceration. And then your axillary lymph node metastasis, of course, if the breast has a lot of lymph nodes, 'di ba? Meron ka sa axillary, meron ka sa cervical. The primary cancer cells, they will work their way into the lymphatic network of the breast, and then they will go to your regional lymph nodes in your axillary, majority of them, and then they will go to your level 1, level 2, or level 3, low, central, and then apical. And then you will have ill-defined and then soft, firm or hard, conglomerate mass, and then they will eventually invade the surrounding tissue. And then, if the regional lymph nodes, the lymph nodes that are here in your breast, they will have distant metastasis later on. So they will now go to your lymphatic and then into your blood because of your neovascularization. Remember that in your breast or in any cancer per se, if you have an increasing an organ size because of cancer cells, nagkakaroon din yan ng neovascularization or what we call angiogenesis to provide blood supply to that growing portion of the cancer. Okay? So now let's go, how do we diagnose breast cancer? So dito naman tayo papasok as medtechs. Okay? So meron bang labs that are available to detect breast cancer? Actually meron, okay? So in your diagnosis of breast cancer, actually what really helps a physician is through a thorough history and physical exam pa rin. So wala pa rin tatalo sa history and physical exam. So the mere fact na tinatanong na namin yung pasyente and then how we will assess the breast by doing clinical breast exams, from that we can actually diagnose your breast cancer. Okay? So these are some presenting signs and symptoms of your breast cancer. You can have breast mass. As I've said kanina, ito yung number 1 na presenting or chief complaint ng majority of breast cancers or mga patients that has breast cancers. Breast enlargement or asymmetry. So kung titignan nyo, mga girls, lalo na kayo, so if you can see that your breast is asymmetric, so magtaka na kayo bakit. Okay? Because normally the breast should be symmetrical. And then, pansinin din nyo, kung maliit talaga yung breast ninyo, if that is the normal size of your breast, magtaka na kayo bakit biglang lumalaki. Huwag kayong matuwa na lumalaki siya, okay? Kabahan kayo, bakit siya lumalaki, okay? And then, nipple changes, retraction or discharge, ulceration or erythema of the skin of the breast, axillary mass, dito sa part na to. That's why later on, no, in the breast cancer or in the self breast exam, you will see the involvement of the axillary part. Musculoskeletal discomfort, as you have seen there kanina, yung Cooper's ligament, nag-originate siya sa muscle portion. So kung masakit yung muscle ng breast mo, most probably you have some type of breast cancer or breast anomaly. History taking should include information on risk factors. That's why tinatanong namin kung alcoholic ba siya, may family history ba siya. Ganun. So 50% no physical signs of breast pathology. That's why it's really important na magpa-screening via mammography because of this high percentage of patients not showing any signs of breast pathology. Sometimes wala ngang breast mass, and then by screening nandun lang makikita na meron pala siyang breast cancer. So mga ganon. And then breast pain, usually they are benign. And then for male physicians, so gaya ko or gaya namin mga lalaki na nagdo-doktor, we should always have a female assistant that is present during examination. And of course, that is for confidentiality na rin and respect to the dignity of our female patient. And history taking should include information on risk factors. So that's the examination part of the breast, no. So you can see here that when you try to assess the breast, dapat naka-midline kayo, hindi nakatagilid or whatsoever. Okay, and then raise your hands, and then from if after raising your hands, you must take note of the symmetry of the breast already. So tignan niyo yung sa ilalim and then all around. Okay, and then you can have here in here your figure B 1.5. This is your quadrants na tinatawag namin. So basically this is your right breast, okay? Right breast, and then this is the axillary process, yung papunta na sa breast na part. So we have here your breast. It is not equally subdivided, okay? So as you can see here, if we divide the breast into quadrants, the superomedial area would be 15%, the inferomedial would be 5%, inferolateral would be 10%, and then your superolateral would consist of 60% because of the axillary process that is attached. Okay? Usually, no, dito sa superolateral part siya nakikita yung mga breast masses. And then by inspection, of course, your arms should be up in the air so that the axillary part is exposed, and also the underneath of your breast is exposed. Hands on her hips, with and without the pectoralis muscle contraction. After raising, no, tignan mo yung breast mo kung may pagbabago ba. And then after nung pagtaas mo ng kamay, ilagay mo yung kamay mo sa hips, and then without contraction, tignan mo kung may nagbago ba. And then you try to contract or mag-flex. Okay? So if flex nyo yung pectoralis muscle ninyo. And then after contraction of your pectoralis, mag-lean forward kayo is to accentuate if there are any skin retractions. Of course, you need to take note of the symmetry, kung pantay ba, the size and the shape, kung nagbabago ba as you perform those things. And then also take note of there is edema or on the nipple or skin retraction or erythema. Ayan. So this is the clinical examination of the breast. Letter A, inspection of the breast with arms at the sides. Inspection. Letter B, inspection with the breast with arms raised. C, palpation with the patient supine. When we say palpation, it can either be you or the physician. But later on, I will show you how to do the self-breast exam. This is for clinical breast exam muna, yung ginagawa ng doktor sa inyo. And then D, palpation of the axilla. Okay? We should not neglect this part, sa may armpit na part. Because sometimes, yung mga sinasabi nyo lang dyan na kulani or yung mga lymph nodes na nag-enlarged or lymphadenitis, actually they are breast cancer na pala. Hindi na lang pala lymphadenitis or kulani, or in Ilocano salsalumagi. Okay, so, and then after inspection, you will have palpation. So using the pads of your finger, first apply light pressure to the breast as you are checking the area, just slightly underneath the breast skin surface. Okay, so as gentle as you can. And then next, apply medium pressure to the breast and then checking about midway inside the breast. And then finally, apply deep pressure. So the rule here is from light and then go medium force and then full force. Okay? Deep pressure. And then feeling the area deepest in the breast. And then you should use these 3 pressures to examine the breast. And then examine the axilla, palpate deep into the axillary fossa. Dito sa may axillary area ninyo, makikita nyo dito yung greatest depression. Tignan nyo din dito sa part na to. Okay, so yun, 3 fingers lang and then use superficial, medium, and then deep palpation sa lahat ng area ng breast ninyo. So, ayan, so this is another picture of your clinical breast exam. So, what is the pattern of palpation, no? So, pwede nyo tong gawin. Actually, ito yung gagawin nyo. So, you can have here your concentric circle. So, start with the large circle around the outside of the breast and then making smaller circles with your fingers as you work your way around the breast. Okay, so pa-circular lang siya. Kapain nyo siya circularly. And then work inward in rings until you reach the nipple. So start kayo from outside and then going inside until, and then yung end point ninyo ay yung nipple. Okay, you can also do the up and down technique. Okay, so imagine the breast as a series of vertical bands and then work your way up and down each one and then move your fingers in small circles as you work around the breast. And then radial pattern naman, mentally divide the breast into a clock pattern. So work from the nipple toward the 12 o'clock and then 1 and then 2, 3, 4 and then so on until you have checked the whole breast. So you can have the concentric method, up and down, and then the radial pattern. Okay, so that is for your palpation techniques. In the diagnosis, we can also have here your imaging techniques. So you have here your mammography. So in your mammography, it is used to detect unexpected breast cancer in your asymptomatic women. As I've said a while ago, 50% will not present any signs of pathology. Okay, so in your mammography, as I've said a while ago, the most common reason why women are hesitant to undergo this procedure is that it is very painful. Pero tiisin nyo na, di ba? Sacrifice a little bit of your pain to ensure the quality of your future, di ba? So in the results of your mammography, even though these are just good to know at your level, no? So this is a picture of your mammogram of the normal breast. So you can see here the skin, the dense fibrous septa, the nipple, the glandular tissue, supported by the connective tissues. And then if you have cancer, so you can see here the difference, no? So in letter A, there is a speculated mass in the right breast. So yung mga arrow natin. Letter B, figure, the mass is seen on oblique view. So nakikita nyo, no? So in the normal breast, ang ganda nung pagka formation ng dense fibrous septa niya. Pero doon sa letter B, nakikita nyo na yung parang umbok or a mass that is being formed. Okay, and then in letter C, there is a spot compression of your mammography view of the cancer seen in A and B. So, yeah. So, another techniques would be your ultrasonography. So, we can also do ultrasound and then, of course, your MRI. But your ultrasound, no, it is usually used to detect the presence of cyst as from mass, okay, because cysts are just benign as compared to your solid masses which are malignant. Okay, and then your MRI can also be done, however it is very expensive. Okay, so and then dito na papasok yung role natin as medtechs. Okay, we can also do breast biopsy. Okay, by the use of your fine needle aspiration, by the use of your gauge 22. So your fine needle aspiration or your FNAB, di ba? This is for cytologic evaluation. So tutusukin yung breast and then particularly on the breast mass and then i-aspirate and then ilalagay sa slide, and then tayo as medtechs, we will perform the cytology aspect of it. That's why in your histopathologist subject, you should also know yung grading, the TNM staging of your cancers, because tayo yung gumagawa nun. Or tayo yung unang-unang nag-a-assess nun. And then, of course, if meron tayong fine needle, we also have here your core needle biopsy. Your core needle biopsy has a larger bore, and which is gauge 14. It's actually the preferred method, no? And it's actually your gold standard for your breast to view the breast tissue architecture. So ayan. We can also have open biopsy. When we say open biopsy, via surgery na yan. So it can be incisional or excisional. So when we say incisional, just a portion of the mass, and then for excisional, we remove now the entire tumor. So open biopsy can therefore be both therapeutic as well as diagnostic. Diagnostic in a sense na kukuha tayo for biopsy specimen, and then therapeutic in a sense na tatanggalin natin yung tumor. Okay. Another diagnostic modality, no, is by the use of your tumor markers. Okay, so what is the tumor marker that is used in breast cancer? It is your CA15-3. Okay, so wag kakalimutan, our contribution as medtechs in breast cancer would be this one, by a breast cancer biopsy, kasi tayong gagawa nung cytologic evaluation, as well as we are the ones to detect or to know the levels of circulating tumor markers like your CA15-3. Okay. So in breast cancer, there are a lot of types. Okay. So at your level, kahit good to know na lang tong mga to. You can have your ductal carcinoma in situ, as I've said kanina, sinabi ko kung ano yung mga ducts. When I say ductal, or when we say in situ, di ba, in the histological makeup of any tissue, we have here your epithelial lining, and then after ng epithelial lining mo, you now have your basement membrane, di ba? And then below your basement membrane is your connective tissue. Okay? So when we say, oh my gosh, na-delete siya. Okay, repeat ko na lang. So we have here your epithelial lining, and then basement membrane, and then your connective tissue. When you encounter the word in situ, it means that the cancer or the abnormal growth of cells is just confined above the basement membrane. Okay, because if ipepenetrate na niya yung basement membrane, that is now what we term as invasive ductal carcinoma. Okay, so the difference between ductal carcinoma in situ and then invasive ductal carcinoma would be the location of the cancer cells. Okay, remember yung basement membrane ang nagse-separate sa kanila. Okay, why am I saying this? Kasi at some point, baka when you will work in the histopath section later on, you might encounter a lot of this terminology, so that these terms will not be that foreign to you. Okay, so your DCIS or your intraductal carcinoma, it's a non-invasive type, or it is a pre-invasive breast cancer. That's why, as I've said a while ago, those females who develop benign conditions like your DCIS or your LCIS, later on down the line, they have the propensity to develop a full-blown breast cancer. And then we also have here your lobular carcinoma. The ductal carcinoma is the ducts, okay, and then the lobular carcinoma is the lobules. And then these are also called as your lobular neoplasia. These are considered to be not a cancer, although the name can be confusing. And then the cells look like cancer cells that are growing in the lobules of the milk-producing glands of the breast, but they do not grow through the wall of the lobules. Okay? So these are your in situ cancers, so they are relatively benign. Okay, but if a female develops this type of cancers, they are predisposed to having full-blown cancers later on. Okay, and then there are also some congenital anomalies of the breast, like your polyphilia, and then your retracted or inverted nipple, macromastia, and then your micromastia, and then your macromastia. Micro dapat yung isa dyan, maliit, and then malaki. So what do we mean by polyphilia? So basically, no, polyphilia literally translates to a lot of nipples. Okay, so you have here your supernumerary nipples, which are in line with your original nipples, no? Because these are remnants of your development. Okay, because as you are growing, the position of your breast also changes. And then yung mga yan na polyphilia are just remnants. Sometimes they are mistaken as moles, parang nunal, but in reality they are actually nipples. Pathologic ba siya? It's not. Okay, hindi po siya pathologic. And then we also have here your retracted or inverted nipple. Sometimes they represent breast cancer, but most of the time, since we are talking about congenital anomalies, they are just a product of failure in the development. Okay, and then a problem that might arise here would be if a woman will now breastfeed. Okay, masakit siya, at the same time mahirap lumabas yung milk. And then what we advise, no, from this types of patients are to be hygienic, because they are prone to mastitis because of the accumulation of dead tissues that in the nipple area. But this is normal. Okay, micromastia, failure of development. So kapag maliit ang breast mo, it's in your genes na talaga yan, maliit talaga siya. Okay, it's because of the failure of development. And then macromastia naman, sometimes pathologic. There is a diffuse hypertrophy on one or both breast, and then occasionally happens during puberty. So sometimes normal, sometimes pathologic naman siya. It really depends now on the symmetry, if there is edema, there is breast, and if there is pain. Okay, so in males, no, we also have here your gynecomastia. So your gynecomastia is enlargement of breast in males. So it can either be unilateral or bilateral. The cause is unknown, but probably related, of course, to hormonal imbalance. So we can have here your physiologic gynecomastia, like in your neonatal, adolescence, and then your senescent gynecomastia. The dominant masses of breast are firmness, irregularity, and asymmetry, suggest the possibility of breast cancer, particularly in older males. So wag kayong pakampante just because you are males, you will not develop breast cancer. No. Okay? If you are a male and then you see that your breasts are enlarging, there is a possibility that you are developing gynecomastia. And underneath your gynecomastia is more detrimental disease, which could be a possible breast cancer. Okay, gynecomastia generally does not predispose the male to breast cancer. However, as I've said, if you as a male will see that there is abnormal growth of breast tissue in your breast, magtaka ka na. Okay, lalo na kung hindi ka naman nagwo-workout o hindi ka naman nagpapalaki ng chest. And there is a difference between chest muscles from your breast tissues. Okay, makikita mo din yan as males if you are aware of your body. Okay, so if we have those types of congenital anomalies, we also have some types of infectious and inflammatory disorders. We can have here your bacterial infection, mycotic infections, and your hidradenitis suppurativa. Okay, so we can also have here your fibroadenoma. Your fibroadenoma are most common breast mass complaint. Sometimes kakabahan kayo kaagad kung may nakapa kayong breast mass, but most of the time, no, these are just your fibroadenomas. These are just very benign types of growth sa breast ninyo. So these are other examples of your common benign disorders of the breast: fibroadenoma, cyclical mastalgia, involution, macrocyst, sclerosing adenosis, ectasia. So at your level, no, your galactocele, wherein it occurs in your lactating women, yung mga milk-filled, the ducts or the milk-filled cyst is inflamed, No, at your level, it is good to know that you are aware of these benign disorders. No? And then we also have here your proliferative disorders without atypia. And then this includes your adenosine radial scars, complex epithelial hyperplasia, and then your intraductal papillomas. In the picture, no, is a very good example of your phylloides tumor. This is favorite nilang tinatanong sa amin. Because your phylloides tumor, although it seems to be very aggressive, it's actually benign. Okay, very benign lang siya, but it's locally aggressive. What does that mean? It is not prone to metastasize or it will not metastasize. Okay? Very locally aggressive nga lang siya. That's why kinakatakutan siya, but hindi talaga siya cancerous or malignant. Okay? So, ayan, local lang siya. Sa breast lang talaga naka-confine yung tumor na yan. So, that is your phylloides tumor. So in clinical staging, this is also one of your concerns as medtech. You should know the TNM staging or the tumor, nodular involvement, and then your metastasis. Okay, so itong grading na to, pwede mong i-apply sa breast cancer or in any types of cancer per se. Okay, so when you say T, it's the tumor size, N, nodal status, and then M for metastasis. So tumor size, ayan, T1 is less than or equal to 20 mm or millimeters, T2 greater than 20, T3 greater than 50, and if you say T4, there is extension to the chest wall and then ulceration of the inflammatory carcinoma. And then regional lymph nodes, NX if lymph nodes cannot be assessed, N0 if there's no lymph node involvement, N1 if level 1 and level 2 are movable, and so on. And in your distant metastasis, M0 if there is no clinical or radiographic evidence of metastasis, and then automatic M1 if there is distant metastasis that has been detected. Most common is in your lungs. Okay? So kung yung breast cancer mo, lumipat na siya sa lungs, that is already M1. Okay, and then of course, we will not end or breast cancer or any disease that we are talking about now, it will not end without talking about their modes of therapy, if they can be treated or not. So basically, in your therapy for breast cancer, one thing to take note is the stage of the disease. Okay? Because if stage 4 ka na, diba, obviously wala nang gamot yon. Okay, palliative care na yun kaagad. Okay, so the types of therapy will depend on the stage of the disease, biologic subtypes, clinical stage, general health status of the patient, histologic characteristics, and of course your biomarkers. And then types of therapy, you can have here your local treatments, which includes, and when you say local treatments, you just concentrate on the localization or on the location of the tumor. So if you have here your mastectomy versus the modified radical mastectomy. In your mastectomy, all breast tissues are removed. However, in your modified radical mastectomy, naiiwan yung pectoralis muscles and the muscles that help now to reconstruct your breast later on. So, in surgery, aside from mastectomy, we also try now to remove the lymph nodes, especially the sentinel lymph node biopsy. The sentinel lymph nodes are the first lymph nodes that are involved in cancer spread. Okay? And then also the axillary lymph node dissection. So tinatanggal din yung mga yan. So later on kung magtatrabaho kayo sa histopath, bibilangin ninyo kung ilan yung lymph nodes that are in the breast specimen. And then of course if surgery, meron din tayong radiation. So we can have external beam radiation and then internal radiation or your brachytherapy. So basically ang ginagawa sa internal radiation, tinutusok yung breast nyo to introduce the radiation on the breast tissue itself. Okay, so yeah, we can also, and that is your radiation is basically good if the type of cancer or breast cancer is angiosarcoma. So we can also have, aside from local treatment, sa local treatment nagfo-focus lang tayo sa breast. And then we also have systemic treatments like your chemotherapy, hormonal therapy, and then your targeted therapy. The targeted therapy are by the use of your kinase inhibitors. Your kinase inhibitors are inhibitors of cell growth or cell proliferations. Okay? So it is designed to block the growth and spread of cancer cells. So versus chemotherapy in which all cells grow quicker, even normal cells. In chemotherapy kasi sinisira natin lahat ng cells. In targeted therapy, only the cells that are abnormal. Okay? So in this one, this is a nice table showing us the treatment or treatment options on whatever clinical stage your breast cancer is. So kung for example, stage 0 ka pa lang, or as I've said, stage 0 or your ductal carcinoma in situ and your lobular carcinoma in situ, they are just for observation, lumpectomy, tatanggalin lang yung mass, ganun, radiation, extensive mastectomy kung talagang kinakabahan ka na. And then stage 1, 1A or 1B, and then andyan na papasok yung mga surgery, mastectomy, radiation, chemotherapy. And as I've said, kapag stage 4 na yan, may distant metastasis na, we can opt to try systemic therapy, like your chemotherapy, but it is not curative, and the risk, mababalik at babalik pa yan kahit ma-declare ka pang actually no, in cancer, I'd like to believe that there is actually no such thing as cancer survivor, because once you have cancer, you will have cancer for life. Okay, nasa dugo mo na yan. And sorry to say, no, but the more appropriate term sana is cancer free and not cancer survivor, because you actually, and hindi siya cancer free. Basta the bottom line there is hindi mawawala yung cancer sa katawan mo. May chance and may risk pa rin na bumalik siya. That's why I really despise this disease actually. And ayoko siya actually na the mere thought of it, no. Mahirap siyang gamutin, and it really takes a lot of life. And yan, stage 4, ayan, prolonged survival, and then just actually enhance the quality of life. So pag palliative care ka na lang dyan. What do you mean by palliative care? We offer na yung best quality of life to a dying patient. Basically, this yung mga patient natin na nasa stage 4 are your dying patients. So this one, the last slides would be concerning now of your self breast examination. So how to do your monthly self examination? You must look at yourself in the mirror and then look anything for unusual, like your irregular shape, dimpling of the skin, nipple discharge, and then ayan, raise your arm at the back of your head, and then your right hand, and examine the left breast, and then moving your hand around the breast for any lumps, and then repeat on the other breast. So basically it's basic, no, to do self breast exam. So why not do it every month? Just remember to do it 10 to 14 days after your menstrual cycle. Okay, ayan. And then I included these steps in your slides para reviewin nyo na lang, and go back to it if you want to perform the self breast examination on yourselves. So if you have any questions, that's the end of our lecture series on breast cancer. So if you have any questions, you are free to raise them in our group chat or in Google Classroom. Okay? So before I end, no, I just want to give credit to my tutor in medicine, Dr. Esperanza Lajos, wherein I adopted most of the contents of my lecture from her lecture in med school. So ayan, yung kung ano man yung mga nakikita nyo dito, no copyright infringement intended. These are all came from the lecture that she gave us. Okay, and that clearly manifests how I adore her and how I idolize her, because she is really one great tutor that I have in med school, and that's why I am also inspired to impart the knowledge that I have learned from her to you, because that's how good her lecture and her delivery is to me personally. So yeah. So again, if you have any more questions, just type them sa group chat. Okay, so have a nice day, and I hope you learned something from this seminar lecture series. Thank you.